So CARMENA trial, it was a randomized clinical trial looking at the role of basically randomizing patients with metastatic renal cell carcinoma. They either were randomized to surgery and sunitinib or sunitinib alone. And in short, they concluded that those who received medical therapy only and did not have surgery did not have a worse outcome, or their progression-free or overall survival was not any worse than those who had cytotoxic nephrectomy. So that's short of conclusion of the CARMENA trial. This trial has issues that have been heavily discussed. One is that basically most of the patients in the surgical arm, not most, 44% or so, were poor risks that normally we don't even consider operating on these patients. A lot of these patients also in both arms were crossed over. Some had in a surgical arm never had the surgery, and sunitinib arm had surgery, and also the volume of the cases per center is questionable. They had, on average, if you look at it, it comes down to less than one patient per center per year. So I mentioned that because volume is important. I mean, these are the patients, these are the kind of surgeries that they have to be done at high volume centers because the outcome is directly correlated to the volume of the hospital and the surgeon itself. So there are some issues with that, but overall, in summary, they showed surgery is medical therapy is not inferior to surgery.